Hello, my name is Eve, and today we'll be talking about stroke. So, what is a stroke? It's when blood rich in oxygen cannot reach the brain. The causes are due to blockages, bleeding. When I mean by blockage, like an embolism, travel, let's say from the leg and travel all the way up to the brain, that's preventing that blood flow from reaching those brain cells because that big old clot is stopping blood flow. Then we can do with bleeding, where you're bleeding inside of the brain, and that can prevent blood from reaching cells. It's two, because it's being poured out of the vessels onto the cells instead of staying in the vessels and being given to the cells. There are three different types of stroke: ischemic, hemorrhagic, and TIA. The ischemic is where blockage of blood vessels lack blood flow to affected area. So we just talked about the ischemic, where we have an embolism or a DVT formed that traveled. It prevents blood from being able to go past the area of clot. These happens due to we already talked about embolism, thrombosis as well, clot form within the artery walls within the neck or the brain, because those are very big vessels there. Okay. Signs and symptoms. Oh, excuse me. Okay, 1 second. So the next kind is the hemorrhagic, and that's when you're bleeding in the brain due to a break in blood vessels. We already talked about that one. This leads to blood cells not being perfused. Causes for your hemorrhagic would be aneurysms. Then we have TIAs, transient ischemic your mini strokes. 1 second. Okay. So transient ischemic attack, are your TIAs. And what you need to know about these is that these are your mini strokes, and these are the warning signs before it can be a warning sign for a pending major stroke. So you don't want the patient to think that they can just ignore that. They still want to go get their head checked out. So now we're going to talk about the brain function and anatomy. So each part of the brain has different functions, and we're going to go over it. So your frontal lobe, it deals with your thinking, speaking, memory, and movement. Your parietal lobe deals with your language and touch. Your temporal lobe deals with your hearing, learning, and feelings. Your occipital lobe deals with your color and vision perception. Your brain stem deals with your balance and coordination. And your temporal lobe deals with hearing, learning. Oh, I already did that one. So your brain stem, your brain stem deals with your breathing, heart rate, and temperature. So when a stroke happens, you can see why they will be acting abnormally given the different functions of the brain if they're impaired. Your stroke could happen on either side of the brain, left or right. This is what happens this is what the right side of the brain controls, okay? Your attention span, showing emotions, ability to solve everyday problems by making decisions, reasoning, understanding jokes, reading in between the lines, making judgment calls, memory recall, music and art awareness, and controls the left side of the body. So if I have a stroke on my right side, my left side is going to be affected. It's going to be weak. And they tend to neglect that side that's not working anymore, and we have to constantly remind them to touch it and to try to engage with it, because it can, if it's just sitting there not being moved, clots can form and then put you at risk for another stroke. Some more okay, so now we're going to talk about the left side, what the left side of the brain controls. Your speaking, writing, reading, math skills, analyzing info, and planning. Okay, so now we're going to talk about the signs and symptoms of what happens if you have a stroke on your right side or your left side. So now we're going to talk about the right side. You're going to have left-sided weakness, hemiplegia, impairment of creativity, arts and music, confused on date, time and place. They can't recognize faces or the person's name, because understand, creativity side, it helps you have an imagination, have a sense of humor with understanding how far humans went to come to this point of healthcare and etc. So they're not going to be they're not going to be creative to make mnemonics for them to remember stuff, okay? Loss of depth perception, okay? Trouble staying on topic when talking. Can't see things on the left side. So if they had a stroke on their left side, the right side is going to be affected. So make sure you tell them to scan the room with their good eye. Trouble maintaining proper grooming, emotionally not going to think things through, impulsive, poor ability to make decisions, and assessing spatial elements like shapes and things like that. Right side continues, they're going to have denial about their limitations, not able to interpret nonverbal language or understand hidden meanings or things because their creativity side is impaired. They're not going to be able to read between the lines to be able to understand jokes and things like that. Very short attention span here on if they have a right-sided stroke, their left side is going to be impaired. They're going to have difficulty reading in between the lines. They're going to be impulsive, okay? Not going to be able to understand jokes or reading in between the lines, okay? So now we're going to talk about the left-sided weakness. You're going to have, left side, if the left side of the brain is injured, what are you going to be able to see? They're going to have right-sided weakness, hemiplegia, remind them to constantly try to move that limb, to touch it, or, because they will neglect it. Aphasia, have trouble forming words and comprehending them. Aware of their limits, they will experience depression, anger, and frustration because they're not able to take care of themselves the way they used to. Trouble understanding written text, issues with writing, agraphia, impaired math skills, because your left side deals with your logic, your one second. So your left side deal with your speaking, writing, reading, math skills, analyzing info, and planning. So when we talk about the thing that's going on, if it's impaired, you can understand why they're going to have aphasia. Okay, trouble forming words that deal with the language and things like that. Logical. Trouble understanding reading text because it deals with their writing skills on this side, so they're gonna have problems with writing and understanding what the words are saying. Issues with writing, agraphia, impaired math skills. Memory is intact. Your memory not intact in right side. Issues with seeing on the right side. We talked about that. So now we're going to talk about the risk factors. Okay, we'll put a person at risk for having a stroke. Smoking, being on blood thinners because that blood is so thin and it can seep out, can rupture, and it'll be real bad there. Rhythm changes like AFib because the AFib makes clots and it's able to travel. Those clots are able to move and travel to the brain. Oral contraceptives, family history, excessive weight with that high cholesterol, that plaque, it builds up and close off the vessels. Senior citizens, because as they age, the vessels become less durable. Hypertension, high blood pressure causes an aneurysm, causes vessels to burst. Atherosclerosis, we talked about that. Physical inactivity, you're not moving around, can cause blood to sit and clot and able to move to the brain. Previous TIAs, those small attacks, if you have one of those. Elevated glucose, because we all should know by now that glucose it makes bridges it makes the vessels occluded with all that sugar metabolized in the blood vessel is going to cause bridges to form. And the aneurysm brain. So you're at risk if you have an aneurysm. So the signs and symptoms of a stroke, it happens suddenly. And you want to call 911, your rapid response team as well. Okay? Note the time because TPA, let me get tissue plasma activator can be given within 3 hours. So that's why we want to make sure we are acting fast and noting the time. Okay, so here's the signs and symptoms of a person that's having a stroke, regardless if it's left side or right side, they're going to be having these symptoms. Facial drooping, when their smile, half of their smile will be crooked or drooped. Arms, their arms are gonna, when they hold them out, one might gradually go down. Okay. Speech, you're gonna have slurred speech because the muscles into the mouth becomes weakened with the stroke. You don't know which part, which nerves you're damaging with a stroke, but when it happens, it affects the your swallowing ability. And we want to act fast on the time, okay? Now we're going to talk about the different aphasias that a stroke patient can have, okay? In any stroke, they can have aphasia, okay? Here's the different types. One, aphasia is you're unable to speak, comprehend, or produce speech, okay? So the first type is receptive. You're unable to comprehend the speech. So the nurse may be talking to you, but you're not going to be able to understand what they're saying because that side of your brain has been impaired. Okay, where you know which side of the area is messed with here is the Wernicke's area. and it's on the left side of the brain. So when you're assessing your patients to see if they're having a stroke, this assessment would help you see which side of the brain their stroke is happening on. This way you can give them enough time, some more time, to be able to get that TPA, to be able to tell the doctor it's on the right side, left side, because they're doing this and doing that, and etc. Expressive aphasia, you comprehend speech, but you can't respond back to it, right? So just imagine you're looking at a patient that might be that can be having a stroke, and you're talking to them, but they can't talk back. It's important that you know this because you don't want to get confused with thinking the patient is doing a behavior or anything like that other than what it is. They can have mixed aphasia where it's both receptive and expressive. One minute they'll be able to talk to you, respond right, and the next they won't. It's very possible. Then we have global, where there's complete inability to understand speech or produce. So this, they're going to be quiet. Then we have dysarthria, this unable to speak due to weak muscle dysarthria. They're going to have trouble speaking, being able to speak, because in a stroke, their mouth getting weak, right? It's going to be hard to talk and swallow with that. Apraxia, can't perform voluntary movement even when muscle function is normal. So just imagine them holding their arms out and it just go down like that. They'll have no control over their arm moving like that, even though there's nothing wrong with their muscle function. Agraphia, lost the ability to write. Just let you know this is affecting the left side of the brain. Then we have alexia, lose the ability to read, doesn't understand or see the words. So they can't read words, they can't understand words, they can't understand written text, reading. Okay. Agnosia, don't understand sensation or recognize known objects or people. So that they might not recognize that that's their husband or daughter that always come in 1 minute. Because when you're assessing, you want to train your residents' LOC, alertness and status and things like that. Because if they start to act up when they're used to doing a certain way, this can help you better detect if there's something going wrong. Then we have dysphagia, issues with swallowing. Hemanopia, this is where you have a limited vision in half of your visual field. So your vision will look like this. You only see half of the image. Okay. Diagnostics, what they do to diagnose this? They can do a CT scan of the head, and they're really checking to make sure you're not bleeding, because they want to be able to give you TPA, but TPA is going to drastically thin your blood. It's going to dissolve clots. It's going to thin that blood. So if you're already bleeding, you're not a candidate for TPA, because it's going to further make you bleed, because it's going to be thinning out the blood. So just know that TPA is only used for ischemic strokes, where there's a clot that's blocking off the blood flow, and that TPA is going to dissolve that clot. Only for ischemic, not hemorrhagic, because it's going to make it more bleeding, more bloody. And you can give TPA within 3 hours of the stroke. So we want to make sure we're keeping track of the time. We want to make sure they haven't received any. Yes, okay. So they can receive TPA within 3 hours of their stroke. You want to check their labs, make sure their glucose is not too high, make sure their blood pressure is not too high, make sure their PT, INR for thinning is not, is within normal range limits, okay? Because TPA is going to come in and do some effects to get that blood clot going. Nursing interventions for TPA. You want to check for bleeding. Make sure they're not bleeding. Neuro checks around the clock. Blood pressure medications if needed, because we want their blood to be able to be perfusing, but we don't want it too high to where it's detrimental. So checking blood pressures, their vital signs, because their blood pressure will be elevated with the body's trying to compensate, but their heart rate would be low and their respirations would be low, and this can increase the intracranial pressure. Because they can have some nausea and vomiting, LOC changes, no pupil response. We already talked about checking their labs, glucose monitoring, preventing injury, because these individuals, their brain is injured. They're not safe to be by themselves, because they might think they can walk, but they can't. They might think they can hold some stuff, but they can't. The priority is keep them safe. Their balance might be off as well, with them having weakness and things like that. We don't want them to fall and cause further damage. Avoid using venipunctures, because if they are on TPA, it's going to thin the blood. If you just stick them, they can bleed out. No IM injections either. And most of the time they'll be going to the ICU to be monitored closely like that. You also want to monitor their airway, because their muscles to their face is weakened, and we don't want them to be eating and they choke, aspirate. We want to check their cranial nerves, make sure pupils are dilating appropriately, check their swallowing. A speech pathologist will come in and see that. Facial gaze, just checking to make sure their cranial nerves are intact. And we're going to check the gag reflex to make sure that they're able to unchoke themselves if they can, if it happens. So we have a skin and limb integrity, because they will neglect that side of their body that's weakened from the stroke. We want to constantly remind them to move it, to not just let it sit there. If they can, do some kind of movement with the other arm, because it can form clots. Doing range of motions and changing their positions every 2 hours. We talked about hemanopia. So you want to just scan the room with their good eye. Their diet, they might be switched to thickened liquids and thickened mechanical soft foods, because it's hard for them to swallow with them having those weak muscles. They might need some assistance with eating, with half their body being down and things like that. Communication, because they're gonna have aphasia. It's gonna be difficult for them to talk. So you make sure you're very patient with them, because they're unable. If they have receptive aphasia, it's gonna be hard for them to comprehend what you're saying. So you wanna use short phrases and simple details. Use gestures and point to things that you want them to know about. Be patient. Remove distractions, and repeat and repeat, because you got to understand they're having a problem with understanding what you're saying, because their brain has been injured. So you have to be patient and make sure they are understanding what you're saying. If they have expressive aphasia, here are some tips here, because they can comprehend, but they can't respond back to you. So you're going to be patient and let them speak. Don't rush. Okay? Ask one question at a time. Be direct and ask questions with simple options, and use a communication board. All right, this wraps up the stroke lecture. I hope y'all learned something. Thanks.